Hello, everyone, and welcome to another episode of Arthritis at Home. Today, we're going to be talking about artificial intelligence, AI, which is changing the way healthcare is delivered across the country, from helping diagnose disease earlier to predicting arthritis flares, supporting treatment choices. AI is the potential and is transforming how patients experience care. But what do people living with arthritis think about AI? To help us answer that and to look at the findings of ACE's most recent national survey, we're joined today by Ellen Wang, Project Manager at Arthritis Consumer Experts. Ellen, welcome to the show.
Always a pleasure, Kelly. Thank you for having me, everyone.
So, another first ever patient-led survey on a topic that is dominating headlines right now, not just in healthcare, but in society in general. AI and Arthritis National Survey is, we're really excited, obviously, to be able to talk about it. And I think, obviously, to be able to share these findings with the people watching today, but also with important stakeholders across our arthritis ecosystem, Ellen. I think that is really the objective for us now, and to see and help people understand what this means for different audiences. So, maybe to start, walk us through who participated in the survey and why are those responses so important to us?
So, Kelly, we had about just under 300 people from across Canada. And these include people living with arthritis, different sorts of arthritis, such as osteoarthritis, rheumatoid arthritis, lupus, psoriatic arthritis, ankylosing spondylitis, and others. And these voices were truly from across the provinces and territories, both in urban as well as remote communities. And about 14% of the individuals who completed the survey identified as Indigenous, Black, or other racialized groups, which is especially important because these populations often face systemic inequities in care but hopefully not in AI.
Right. And I think what's important to note too that when people look at our report summary, which we'll provide links to at the end of this, we also included a lot of comments because we offered some open-ended opportunities for people to answer, and particularly with some of these subpopulation groups, and you identified Indigenous, Black, racialized groups. Really important that we're able to sort of gather that personal feedback as well, and something that people will be able to see in the report. So, what were the top things that people told us about AI in their care?
Kelly, there are about three kind of main themes that were really strong throughout kind of multiple questions. So you saw them come up and then again and again. The first one is awareness. So we found pretty big gaps. About 22% of individuals said they understand or they know what AI is very well. So they're very familiar with it. On the other hand, about 43% of respondents actually admitted they were unsure about how AI is being used in arthritis care, if at all. At the same time, more than three quarters, about 75, want to learn more about AI. So you can tell that there is interest. People want to know how it is being used. I think second is trust. So this theme of trust you can see in the open-ended responses that you had mentioned, Kelly. And people are just, cautious. They're they're very, very, very much so, I would say, right to be cautious. For example, and about 79% of respondents said that they trust AI to improve accessibility. 75% say they trust it to help with early detection. But only about 30 to 31% were comfortable with AI actually making the decision on its own. So they like AI, the thought of AI to help, right? To be as an assistant, to act as a kind of another pair of eyes on top of a healthcare provider, but not on its own. And third, the theme was around patient concerns. So, misdiagnosis was one of the biggest worries.
Hmm.
Another was the loss of human connection, right? So, not only do people want, AI to act as a second pair of eyes, never to replace, for example, a healthcare provider or rheumatologist, but they actually we like part of care, right? Part of therapy is that connection that we have with the person sitting in front of us. And about 53%, so about half, were concerned about data privacy.
There's trust, but there's strings attached to that trust.
As there should be, yes.
Yeah. So, we've heard the calls for this from other audiences and populations as well, but the importance of transparency and that human connection that you talk about, that human oversight. So, great and I think insightful findings for us, and looking forward to sharing those again with those key stakeholders. What about were people able to identify, the different kinds of opportunities that they see where AI can improve arthritis care specifically?
Yeah, one of the interesting kind of areas was how AI could help manage surgical wait lists, especially for joint replacements, by
Yeah,
kind of prioritizing, patients more efficiently, more effectively. Others highlighted early diagnosis, where AI could help actually detect inflammatory arthritis, hopefully, as it occurs, or really try to catch it before it occurs.
sure.
And in terms of everyday care, about 27% of respondents said AI tools would make them feel more confident in treatment planning. Again, if used alongside their doctor, so just a second pair of eyes, a little bit more input. And about 61 said they would feel comfortable with AI treatment plans again when the actual healthcare provider is there with them. So you can see like people are open. They want AI to do things. They see the potential, but like you said, strings attached.
So, key takeaways that you shared. What does this mean now for people with arthritis, for their healthcare providers, for policymakers? What does this where does this point to or signal for the future of arthritis care in Canada?
Yeah, Kelly, I was surprised when I first saw the results and all the
Yeah,
data that came out. It seems more positive. Like people see the potential, absolutely. Um, but as one person said, only if it's developed and used responsibly, right? That's kind of the key. So when you think of development, like who is designing AI, right? How are they training it? What data are they training it on will then determine the responses that it generates. And then responsibly meaning like AI isn't necessarily meant to be on its own, right? Even if it can be on its own, like you can tell that people have a preference for the doctor to still be there, for the rheumatologist to still be there, right? So how do we integrate it without, trying to push it as a replacement, right? And then how do we protect, the last piece, which is the privacy, right? About 50% of our actual cohort, our respondents had said, they are worried about how their data is being protected. So I do think if these conditions are met, AI does have potential, right? I think it's actually very clear how much potential it has. And points that you had noted at the beginning, right? Speeding up diagnosis, helping patients match them with the right biologic sooner, right? So they don't have to try a bunch of medications. They know right away which ones would give them the least side effects. And it would expand access for individuals living in rural and remote populations in Canada.
really exciting. And I think what's helpful in terms of the summary report is we are able to provide people a glossary if they're unsure of terms, because I think that could be a barrier as well. And also some really good references. So people, please, our audience, please take a good look at that JHI, Joint Health Insight, that covers a lot of the data points and proof points that Ellen has been able to describe for us. So I think in closing, Ellen, I totally concur with everything you've said. I think there's some really important messages and findings here for government in terms of ensuring that the application and design in the future and currently with AI is designed with transparency and equity in mind. And for our healthcare providers in the arthritis world, integrating it but not replacing their roles. And we really look forward to sort of helping lead this conversation across the country. Anything else that you want to add at this point, Ellen?
No, I'm really grateful for the individuals who took the time to complete the survey. It truly means the world to us, and we couldn't do this without you. I'm actually really happy to see the caution, right? The optimism, the potential, but I really appreciate the caution. I do think it's not to say it's warranted, but I think it comes from a really good place.
Absolutely. And after you've looked over the findings in the JHI, we'd love to get your comments and feedback. And there is a link there, I think, at the end of the JHI, where you're going to be able to provide that. So, ongoing consultation with people with arthritis across Canada as part of our education and advocacy efforts around AI and arthritis care. Ellen, thank you so much for taking us through the findings. Really appreciate your time.
Thank you so much for having me, Kelly, and thank you again, everyone.
Indeed. Thank you for watching and participating in the episode today, and look forward to seeing all of you again in a future episode of Arthritis in Home. Bye for now.